I want to talk to you about how weight loss and an anti-inflammatory diet can significantly reduce symptoms related to arthritis. I'll go over what happens to people's arthritis symptoms when they undergo massive weight loss. I'll also review what other studies say about how much weight you actually need to lose to get significant benefits. Lastly, I'll review the best types of foods you'll want to incorporate into an anti-inflammatory diet. Hey everyone, Dr. Jeff Peng here. Arthritis affects millions of people worldwide, and while there is no cure for it, there are many ways to manage its symptoms and improve quality of life. One of the biggest pillars of arthritis treatment is weight and load management. This includes both weight loss and diet. Let's first focus on weight. I think it's important to mention that both obesity and an increased body mass index can have a direct effect on arthritis progression and symptoms. For instance, people who follow a typical Western diet, which includes large portions, high calories, and excess sugar, and people with obesity tend to have higher rates of metabolic syndrome. This can increase the risk of developing various health problems, including worse arthritis. A recent study found that people with higher metabolic syndrome severity have worse progression of osteoarthritis, as defined by worse bone spurring, worse bone marrow lesions, and worse defects in their cartilage. All of this indicates worse progression of arthritis. The counter to this is that significant weight loss leads to dramatic improvements in pain, function, and joint structure. This study looked at what happened to people's knee arthritis after undergoing bariatric surgery, also known as weight loss surgery. The subsequent massive weight loss resulted in significant decreases in knee pain scores as well as improvements to WOMAC osteoarthritis index scores. In addition, arthritis is made worse by increased levels of inflammatory markers within the body or within a joint. Typical Western diets are high in refined carbohydrates and saturated fats that can lead to an increased production of pro-inflammatory cytokines. Higher levels of these pro-inflammatory mediators are associated with higher pain sensitivity and worse symptoms. So that same study found that bariatric surgery and massive weight loss helped to significantly reduce inflammatory markers, specifically C-reactive protein as well as interleukin-6. Higher levels of these markers are typically associated with worse pain and worse symptoms. In addition, weight loss resulted in increased biomarker levels related to cartilage synthesis, which is a positive sign of cartilage health. It also resulted in significant decreases in biomarkers that result in cartilage degradation. Again, a positive sign of cartilage health. Okay, so that's bariatric surgery, but not everyone wants to undergo weight loss surgery. What are some of the other options out there, and is there a list of some of the best options that can help with weight loss? That's what this study tried to answer. This is a network meta-analysis that wanted to compare the efficacy of different weight loss treatments on knee osteoarthritis. They included data from 30 clinical trials comprising 4,600 patients. The authors found that the most effective interventions in reducing pain related to arthritis were bariatric surgery, low-calorie diet and exercise, and intensive weight loss and exercise. So this study tells us that weight loss can be really beneficial in improving arthritis symptoms, especially when combined with exercise. But now the question is, how much weight loss is actually required to get those benefits? That's what this systematic review and meta-analysis tried to answer. They took data from 7 clinical trials which comprised over 1,100 patients. The results showed that a 5% weight loss produced a small positive effect on pain, self-reported disability, and quality of life in adults with obesity and with mild to moderate osteoarthritis of the knee. A 10% weight loss had moderate to large effect sizes on the same patient-reported outcome measures. So there is an abundance of data that supports the argument that weight loss can dramatically improve symptoms related to arthritis. Now let's talk about diet, because it does seem like an anti-inflammatory diet, independent of the weight loss associated with it, can also reduce symptoms related to arthritis. As we all know, diet plays a major role in determining your weight. Studies have shown that anti-inflammatory diets, such as the Mediterranean diet, can offer a wide range of health benefits. Not only can it lower the risk of heart disease and cancer, but it can also improve brain health, lower the risk of developing diabetes, aid in weight management, and improve symptoms related to arthritis. In addition, anti-inflammatory diets are typically filled with plant-based foods that have high dietary fiber. These fibers can alter the composition and metabolic activity of the gut microbiome. This can lead to even more anti-inflammatory effects. So that's in theory, and now let's look at what the clinical trials say about the effects of an anti-inflammatory diet. This systematic review and meta-analysis wanted to see what benefits a low-inflammatory diet had on people with arthritis. They included 7 clinical trials for a total of 468 patients in their meta-analysis. All intervention diets were non-calorie restricted. The results showed that after 4 months of intervention, the low-inflammatory diet group had greater weight change when compared to the usual diet group. Inflammatory biomarkers, including C-reactive protein and interleukin-6, were also found to be lower in the low-inflammatory diet group. Subgroup analysis showed that patients with rheumatoid arthritis who were in the low-inflammatory diet group had better improvements to physical function as well as reduced joint pain than the control group. Very interestingly, though, this effect was not seen in the osteoarthritis group. This other systematic review and meta-analysis found similar results. They included studies comparing the effects of common anti-inflammatory diets, including the Mediterranean diet, vegetarian diets, and vegan diets, and compared them to ordinary omnivorous diets. Pooled results showed that the patients on anti-inflammatory diets reported significantly less pain than patients in the control groups. They also had more improvements on health questionnaires as well as lower swollen joint counts. In addition, patients on anti-inflammatory diets lost more weight and decreased their BMI more than the patients in control groups. Subgroup analysis showed that the Mediterranean diet tended to have a greater effect on outcomes than vegetarian or vegan diets. In addition, studies with longer intervention periods show greater effects for the anti-inflammatory diet. The authors do report that all studies had a high risk of bias and that more clinical trials needed to be done. Okay, so the first thing I want to say is that it is incredibly difficult to run studies when it comes to diet. It's virtually impossible to do a true randomized placebo-controlled trial when it comes to diet. After all, you can't blind yourself to the types of foods that you are eating, and people do tend to cheat. They overestimate certain foods that they are eating and underestimate foods that maybe they shouldn't be eating. But even within all of these limitations, it really does seem like an anti-inflammatory diet has independent benefits in reducing pain and symptoms related to arthritis. Some studies even suggest that anti-inflammatory diets can decrease levels of inflammatory markers. This would potentially slow down the progression of arthritis. Anti-inflammatory diets are also more effective than other types of diets when it comes to weight loss. And we now know that there are multiple systematic reviews and meta-analyses showing the tremendous benefits to overall symptoms related to arthritis when you're able to achieve weight loss. By the way, if you're enjoying this content so far, please do me a favor and click the like button. It will help the video spread to more people and help them too. Thanks for doing that, I really appreciate it. Okay, so the last thing I want to focus on are the foods that are commonly included in an anti-inflammatory diet. This is not meant to be an exhaustive list, rather more a guide to help you decide which foods you may or may not want to include in your diet. What you'll find is that the more colors of foods that you incorporate into your diet, the better. Each color represents a different phytochemical and antioxidant that has amazing benefits to the body. So let's start with fruits. Typically, berries are considered to have the highest amounts of antioxidants. These include blueberries, cranberries, blackberries, raspberries, and strawberries. Other fruits rich in antioxidants include pomegranates, cherries, kiwis, grapes, and citrus fruits. Vegetables are also extremely high in antioxidants and can protect the body against free radicals and oxidative stress. Leafy greens and cruciferous vegetables are particularly high in antioxidants. These include kale, spinach, cabbage, broccoli, cauliflower, and Brussels sprouts. Other colored vegetables can also reduce inflammation. These include carrots, eggplants, tomatoes, beets, onions, and garlic. All of these colored vegetables are rich in vitamins, minerals, and fiber. Speaking of fiber, it is essential for a healthy digestive system as it helps regulate the gut microbiome. Fiber has tremendous benefits to overall cardiovascular health as it helps regulate cholesterol and blood sugar. High fiber foods are also filling. This helps promote feelings of fullness, which also supports weight management. Examples include oats, brown rice, quinoa, barley, and whole wheat. And what about proteins and fats? Fatty fish are particularly high in omega-3 fatty acids. Fatty fish include wild-caught salmon, sardines, mackerel, herring, trout, tuna, and anchovies. Nuts, such as almonds, walnuts, cashews, and pistachios, as well as seeds, such as chia seeds and flax seeds, are also rich in protein and omega-3 fats. Other types of healthy fats can also be found from olive oil as well as avocados. Now, the last thing I want to mention is that while weight and load management as well as diet is incredibly important for the management of arthritis, it is only one part of taking a multimodal approach to treating arthritis. We've gone over how bariatric surgery and massive weight loss results in significant improvements to symptoms related to arthritis, but this study actually looked at the long-term effect of obesity and bariatric surgery on the incidence of hip or knee replacements. They found that over the course of 20 to 30 years, bariatric surgery did not normalize the increased risk of knee and hip osteoarthritis in patients with obesity, but was associated with an increased incidence of knee arthroplasty compared to the control group. This is an extremely counterintuitive finding, and researchers are still trying to piece together explanations for why massive weight loss was associated with a higher incidence of getting knee and hip replacement surgery. There are lots of potential explanations for this finding, but I think the main takeaway is that you just can't focus on one modality for treatment. You really do need to take a multimodal approach and incorporate all of these treatments to not only help reduce symptoms related to arthritis, but also to help slow down the progression of arthritis. Some of my favorite treatments include platelet-rich plasma injections as well as exercise therapy. You'll definitely need to check out these videos next to learn more. Thanks for watching.